The connection between humans and animals is one of the most fundamental bonds that humans experience. Humans have been interacting closely with the animal kingdom for tens of thousands of years. The roots of human-animal interaction can be seen in ancient paintings and carvings, such as the Aboriginal petroglyphs carved into sandstone bluffs. That powerful and mutually beneficial bond continues today, with people and animals connecting in ways that are essential to the health and well-being of both. There are many ways humans interact with animals. We raise animals on farms for food production, and they provide us with a wholesome and sustainable supply of beef, pork, poultry, dairy products, and eggs. Some of us keep animals as companions, such as cats, dogs, horses, rabbits, other small mammals, and reptiles. Oftentimes, we get to interact with animals in a public setting, such as at fairs, animal exhibitions, open farms, schools, or during school field trips, and at petting zoos. For most of us, public events like these are places where we can interact with animals that we don't get to see on a daily basis. At the petting zoo, for example, you might get to hold, pet, or feed a variety of animals, including sheep, lambs, pigs, cows, horses, donkeys, chickens, goats, and rabbits, ducks, geese, just to name a few. For most people, this is as close as they'll ever get to farm animals. Visiting a fair or petting zoo can be a fun and educational experience. However, any contact with animals must be done in a safe way. It's important for visitors to understand the risks associated with animals and disease transmission. Sometimes harmful pathogens can be spread from animal to humans, which might make you sick. However, there are simple precautions that can be taken to reduce the likelihood of illness. This video will cover the three main tools for reducing the risk of disease transmission from animals to humans. Become aware of the risks associated with human-animal interactions. Understand appropriate sanitation and hygiene, and be aware of risky behaviors to avoid. Pathogens that are transmitted between animals and humans are known as zoonotic pathogens. These can include protozoa such as Cryptosporidium, Giardia, and Toxoplasma. Fungi such as the species responsible for ringworm. Viruses like the West Nile virus, hepatitis A, and influenza, or parasites such as trichinella, tapeworms, and nematodes. However, the most commonly acquired zoonotic pathogens are bacteria. You might not know it, but bacteria are everywhere. All animals, even humans, carry bacteria on and inside their bodies. In fact, human bodies contain 10 times more bacteria cells than human cells. Most of the bacteria around us are good bacteria, indifferent and harmless. However, a few are harmful and can make us sick. The most common pathogenic bacteria transmitted from animals to humans cause gastrointestinal illness. Such an infection will often be dismissed as an upset stomach, but can sometimes progress into more serious illness. Although these bacterial pathogens can be acquired by humans in different ways, scientists estimate 14% of illnesses due to these bacterial pathogens are from direct contact with animals. Although animals can appear healthy and not show any signs of being sick, they can still naturally shed harmful bacteria in their feces or saliva. Animal feces can get into the hair, fur, or feathers of the animal, bedding, or the soil. When you touch an animal's fur or the area around an animal, you could be getting bacteria on your hands. If you touch your face or mouth or eat or drink something before washing your hands, the bacteria can get from your hands into your mouth and potentially make you sick. An animal's saliva and nasal secretions can also carry pathogens. These can be spread to humans through bites, licks, or scratches. Although anyone could get sick from zoonotic pathogens, some people are more at risk than others. High-risk individuals include small children under age 5, elderly persons, and pregnant women. People with weakened immune systems are more susceptible to infectious diseases, and such infections can have serious consequences for their health. When you get sick with these bacteria, you may have a fever, stomach cramps, or diarrhea. You might also feel nauseous or vomit. If you have these symptoms, it's encouraged to get rest and drink lots of water. You should visit your family doctor if your symptoms persist for more than 5 days or increase in severity, if you develop bloody diarrhea, or if you show signs of dehydration. In some cases, people have been hospitalized due to infections with zoonotic bacteria. Some pathogens are more dangerous than others because of what's called a low infective dose, meaning that very few cells are required to make a person sick. This is the case for what people call hamburger disease. For example, scientists estimate that it takes 1,000 cells of one pathogen to make a person ill, while only 10 cells of a different pathogen may lead to severe illness. Typically, treatment for infections with these bacteria include fluid and electrolyte replacement and control of nausea and vomiting. For gastrointestinal infections, antibiotics are not usually used since they can often make matters worse rather than better. If you're visiting a fair or a petting zoo, you should always make sure you wash your hands at the end of your visit. Washing your hands is the #1 protective measure against pathogenic bacteria. When you wash your hands, always make sure you use warm water and soap. Rub your hands together for 20 seconds. This is about as long as it takes to sing the ABC song. Don't forget to rub the palms, fingers, fingertips, nails, and the backs of your hands. Rinse your hands for 10 seconds under running water. Dry your hands completely with paper towels. Don't dry your hands on your clothes. Finally, if the sink does not automatically turn off, use a paper towel to turn the taps. Although hand sanitizers can help to kill some bacteria, it doesn't kill or remove them all from your hands, especially if you still see dirt on your hands. Many of the sanitizers are inactivated by organic matter in dirt. Hand sanitizers should not be used as a replacement for washing your hands. You should always wash your hands after touching or feeding an animal or touching its cage. You should also wash your hands after falling or touching the ground, cleaning or removing your boots or shoes after leaving an animal area, and especially before eating or drinking. Some rules you should remember when around animals or in animal areas include: do not eat, drink, chew gum, or smoke. Do not let small children lick or suck their fingers or bite their nails. Do not let children touch their faces or mouths. Do not give children bottles, pacifiers, or soothers. Do not let children pick things up off the ground. Do not kiss or snuggle the animals. Do not let small children share food with the animals. It's recommended that all animals at a petting zoo are separated from visitors by a fence. However, some petting zoos will allow animals to roam freely among visitors in the petting area. Visitors should remember to approach animals from the front or sides where the animal can see them, not from behind. Animals should never be cornered and only pet on the neck and back. You should not pet animals near the mouth or the hind areas to avoid being bitten or kicked, and to reduce the likelihood of pathogen transmission. Always speak with a low, calm voice and avoid making fast or loud movements which might scare the animals. The layout and maintenance of facilities in animal exhibits can also have an impact on the risk of infection. Important factors that will decrease the risks associated with zoonotic pathogens include careful planning of human traffic areas, safe areas provided for visitors to store their belongings such as strollers, diaper bags, baby bottles, pacifiers, and toys before entering the animal area so that these items do not become contaminated. Hand washing stations stocked with soap and paper towels are necessary. There should be several hand washing stations to adequately serve the number of visitors at the event. Automatic sinks, soap dispensers, and paper towel dispensers are best for minimizing cross-contamination of hand washing station surfaces. Signs should be posted reminding visitors when they're entering an animal area and the risks associated with animal contact. Signs should be posted reminding visitors to wash their hands before exiting the animal area. Staff members or volunteers should monitor the hand washing facilities to remind and encourage hand washing by visitors and ensure the supply of soap, paper towel, and water in portable sinks does not run out. A service access point should be used to allow movement of animals in and out of the area and for transporting animal feed, waste, and other potentially contaminated materials. Service access points should not be accessible to visitors and should allow movement of animals and materials without contaminating visitor areas, fence rails, and walkways. Staff organizers should maintain a clean environment within the animal areas. Feces and soiled bedding should be removed promptly and stored away from visitors. Surfaces such as handrails and doors should be disinfected regularly. Animal exhibits should be separated from food preparation and eating areas. All kitchens and, if possible, eating areas should be enclosed. Visitor walkways, fences, and handrail surfaces throughout the animal areas should be constructed of material that allow cleaning and sanitation. Concrete is recommended over dirt flooring since pathogens can survive in soil for months at a time. Similarly, metal fencing is best because it's easier to clean than wooden surfaces. Consideration should be taken when disinfecting surfaces in the animal area. Appropriate sanitizers should be used, such as household bleach diluted in water, which is prepared fresh daily. Visible dirt or feces should be removed from surfaces first, followed by spraying on the disinfectant. Most compounds require sufficient contact time with the contaminated surface, often around 10 minutes, for effective disinfection. Visitors should be aware of the risks associated with feeding the animals at a fair, open farm day, or petting zoo. It may put visitors at higher risk of acquiring zoonotic pathogens and physical injury due to bites. Furthermore, animal feed should be provided in non-edible containers rather than ice cream cones to help prevent small children from ingesting them. Physical barriers and proper design of stabling areas, animal enclosures, and petting zoos are important to minimize the risk of physical injuries. However, accidental bites and visitor falls can still happen. Organizers should be educated in basic first aid care and what to do in emergency situations. Petting zoo owners should monitor the animals daily for signs of illness. All animals should receive appropriate veterinary care, including vaccinations and parasite control. Animals that are sick or have come from a herd with a recent history of abortion, diarrhea, or respiratory disease should not be exhibited. Prolonged transportation, confinement, crowding, and too much human contact can make some animals stressed. Stressed animals are more likely to shed pathogens in their feces and more likely to acquire diseases themselves. Furthermore, stressed animals could be more likely to injure visitors by biting or kicking. Animal owners should assess their animals for stress and employ a rotational system to remove animals from human contact areas, allowing them to rest. Animal owners should be aware that shedding of pathogens by some species is often higher in younger animals, which are frequently used in petting zoos. Some animal species tend to shed more pathogens in the summer months than the rest of the year, during peak season for fairs and petting zoos. Also, commingling of animals can increase the probability that animals shedding pathogens will infect other animals. Hygiene of the animals and their surroundings is critical to the health of both the humans and the animals. Event planners, designers, organizers, visitors, educators, and public health officials are encouraged to implement these guidelines and do their part in reducing risks associated with animal educational activities. Keeping facilities, animals, and visitors clean and informing visitors of risky behaviors to avoid may lower the risk of infection. Know the risks, have fun, and be safe.